Hello, everyone. Thank you for joining this presentation. I am Teresa Slottick, and I'm going to be talking about digital health literacy and talking about some tools that can help you work with patients to give them the digital skills that they need to access healthcare. I am the Strategic Partnerships and Northstar Business Development Manager with Northstar Digital Literacy, which is a program of Literacy Minnesota, a nonprofit that's been around for about 50 years. And we have focused on adult literacy for that whole time, and digital literacy being a part of that larger whole. So today we're going to talk about a little bit about digital equity and how healthcare fits into that and why it's important to healthcare. We'll look at the tool, Northstar Digital Literacy, the free assessments and the practice lessons that you have access to through us. And then we will look at the Digital Equity Act and how you as healthcare advocates can hopefully advocate for the needs of patients around digital equity and digital literacy, as well as maybe how you can form partnerships with other organizations. So I first want to talk about when we talk about digital equity, we like to think of it as a three-legged stool. And the three legs of this, and some other organizations call it a four-legged stool, but the three legs of the stool are devices. So you have to have a device, access, you have to have an internet connection, and then the thing that's often forgotten are the skills to use those. So if I give someone a laptop and I give them, a strong internet connection, and they don't know how to use it, they're really useless, right? So we need to be able to provide people the skills to use these other legs of the stool. Otherwise, our stool falls over. So why is digital equity important to healthcare? We have seen that many people, just in general, don't have digital literacy skills in the United States. And oftentimes people think that these are all older people. And that's not true. I hear in my work a lot from even community colleges and four-year colleges that people coming into those programs don't have, maybe because they've only been using Google Docs and Google Slides, they don't know how to do file management, for example. So it is really across all ages, but it does affect the races differently. So more people who are Black have fewer the percentage is higher who have digital literacy skills. Same for Latino. And so it is an equity issue. We do, however, see many adults having concerns using digital literacy, and especially around using it for healthcare. So we want to be sure that all the patients have the same accessibility to what is being provided. And we often think in healthcare, it's often thought about language, and something's written in 12 different languages, which is great, but it's all put on a website, and so or sent an email. And if someone doesn't have the digital skills to access those modes of communication, then they are being shut out. So Northstar, a little bit about Northstar Digital Literacy. We are again, part of Literacy Minnesota, and Northstar is really a platform to help individuals assess what they already know, and then determine where there's opportunities for learning, and then hopefully they'll get that education. Northstar is, there is a free version, which I'm going to talk about today. There's also a subscription version that gives you more access to curriculum and reporting features. And so of that version, we have almost 3,000 subscribing sites. No individual ever pays for Northstar. It's always an organization like a library or an adult education center or a community college, for example. But many people access Northstar, and many organizations, through our free version, which I'll show you today. So Northstar was written initially in English. We are now translating it into Spanish, and half of it is available in Spanish at the moment. I just heard today that the Team expects all of the assessments will be available in Spanish by the end of July, as well as the practice lessons we have available for free. You can use Northstar. It's 100% compatible with desktops, laptops, and Chromebooks. I know many of your patients may have tablets. You can use it on a tablet. There's a few drag and drop questions on the assessments that don't work, and people just would skip them. You can use it on a cell phone, but honestly, it's not a very good user experience. And so we are working with a user experience group to make it fully mobile compatible on both those types of devices. And we'll roll it out over the next year or so. The good news is that the telehealth assessment is mobile compatible. So that's the only one at the moment that's mobile compatible. So if you want to try one on your cell phone, that is the one I would recommend. And we'll talk about that in a bit. So the way Northstar has worked in the past, we were approached back in the last Great Recession by our local library who had people coming into the library who wanted to learn digital skills. And the library felt that they needed a way to kind of sort them into classes so they would not have such a wide range in any one class. They'd actually be meeting people's needs. They came to Literacy Minnesota. We have people, experts on staff, and are connected with experts nationwide around digital literacy. And we started thinking, okay, so here's the need, and how are we going to, fund that? So we got funding together, and then we assembled a team of these experts, and they looked at existing literature, or if there was any existing assessments out there already, and there weren't. And they started thinking, well, what is basic digital literacy? What falls under that? Things like how to use the internet, how to use email, some kind of basic things like that. And once they decided what topics fell under it, they then started creating standards. But in that whole process, they gathered learner input to see what did people want to know and what did they feel like they were missing out on. So all along the whole process, there was learner input in terms of before it was created, after it was created, and helping tweak the assessments. The standards, which are the skills, so once they had decided on the topics, for each topic, like using email, they created a set of standards. And the standards really say, these are the skills that we feel are important to be competent in this topic. So for example, one of the standards in using email is how to attach a file to an email. So that is a skill. And the skills, the standards are usually demonstrable skills so that you can say either person knows how to do this or they don't. We review those standards periodically, all of them. If we hear about a change in technology, then of course we would review the standards at that point. And when we hear from our subscribers to say maybe this needs to be changed, we will collect that information and then we'll make the changes kind of in batches. So here are the standards, here are the topics that we have under kind of basic digital literacy. And you can see, especially if you're working with patients on teaching them digital literacy skills, under essential computer skills, these are kind of the building blocks. So the basic computer skills, internet basics, and using email, these skills are pretty necessary for a lot of patient-doctor interaction. Windows 10, Mac OS might be important, whatever operating system they're using, maybe not. There is essential software, and then you can see under using technology in daily life, we do have the accessing telehealth appointments. And that came about because after about 2 years of talking to people in the healthcare industry from all kind of areas, from providers, insurers, patient care advocates, health literacy people, federally qualified healthcare centers, kind of the gamut, nurses, hospitals, kept hearing that one of the things that patients really struggled with around digital literacy in healthcare was how to access their telehealth appointments. So we felt that would be a good place to start. We hope to add more health-related topics to Northstar, including how to use a wireless medical device, how to access your healthcare portal, kind of things of that nature. But at the moment, we do have the accessing telehealth appointments. And I would say, I think we're getting about 1,200 people taking an assessment a month at this point. So it is being used. We also have your digital footprint, which talks about how to kind of keep yourself safe online a little bit, in terms of whatever you put out there is going to be out there for the public to see unless you need to be aware of that. So those are some of the information literacy too might be useful to patients in terms of that's not how to search, but how to search well, so that you are kind of using your critical thinking skills to search, putting in search terms that are going to get you relevant hits, making sure you know what sources are reliable. So you all have access to the standards. So as you are creating health literacy, digital health literacy curriculum or teaching classes, you can use our standards and say, okay, these are the skills that Northstar felt were applicable. And so maybe we can make sure we include those skills. If you do happen to have Northstar as a subscriber, if you have access to Northstar as a subscriber, then we do have curriculum that are aligned with the standards. But again, you can use our standards. So where you're going to find them is on the Northstar homepage, which is, you can see here on my screen, the www.digitalliteracyassessment.org. And I'm going to go in there to show you kind of what this looks like. So bear with me for a moment. So actually, I want to go to where you see. So this is the website you'd come to if you put in digitalliteracyassessment.org. If you type in Northstar, you'll also find us, Northstar Digital Literacy. And so I'm on the main page here. And if you look in my black navigation bar on the top where you see the Northstar logo, over to the right in the middle kind of, you'll see the second tab says features. If you click on that, and then underneath this lady's face, you see the Northstar standards. So I click there. Then here they are kind of arranged just like they were on my slide. And if we look at, let's say we'll look at accessing telehealth appointments. Here are those standards. So again, you can see they're very, broken out into very granular skills, right? So how to create a secure password, how to log in and sign out of an online health portal, how to use a virtual meeting feature, including video and chat. So they really do kind of remind you of all these very basic skills that people need to know to have a telehealth appointment. And we know that in healthcare, telehealth appointments aren't going away. They're really great for people who don't have transportation, who don't have childcare, who may live far from their doctors. I've heard, especially with mental health, it's often preferred, so you don't have to have the stigma of going into someplace. You can do it from your own home. The stigma that's perceived by some people still. So here are the standards, and you can see too that you can, there's standards for the basic computer skills, which starts with, look at standard 3, how to log on and shut down a computer. So really starting from the beginning here on the skills needed to kind of operate these systems. So if we go back to our slides, the way Northstar develops things is it's called the backward design process. So first we will create these standards. So we'll say, what are the skills that are necessary to be competent in this area, right? And basically, what do we want people to understand and know and be able to do? Once we've identified those standards, then we want to determine, how do we know that someone knows that information? So then we create an assessment that lines up with those standards. And then we would want to say, okay, if someone doesn't have these skills, how can we help learners learn those skills? And so that's where various types of curriculum would come in. when you, the way we envision using the Northstar assessments, which are also free, and I'll show you where they are, is that we recommend you give them kind of as a pre-assessment to determine what someone can do and maybe where they might need some instructional help. Always remember that someone's language skills are not commensurate with their digital skills. So someone could be very high in understanding English and not know much about digital literacy, or they may have low English literacy, but be really knowledgeable about computers. So just remember they don't always link together. The Northstar assessments can be helpful too if you're teaching a class and you want to know, what is the range of skills in this class? Where do I need to start if I'm teaching a digital health literacy class? And you can also use that in a class setting where you'll see each student will get a results page. Each learner will get a results page. And you can create a spreadsheet to kind of track which standards what people know. And so you can have kind of a graphic picture of in the class that you're teaching, what skills you want to focus on. So the assessments are the same as the standards in terms of the same topics. You can see that the ones in red are those that are currently available in Spanish. I have heard from Spanish learners that they really appreciate, obviously, Northstar being in Spanish because it helps them really show their digital literacy without the language barrier. Many people who I have talked to say that they want to pass the assessments in Spanish first and then pass them the same assessment again in English so that they are learning the English terminology for these topics. And I thought that was like a really cool idea. So you can see that the team right now is working on translating social media and then Mac OS, but the accessing telehealth appointments and all the basic essential computer skills are in Spanish already. So when you take an assessment, what's a little bit different about Northstar is that they are usually, except for the very basic ones, they're usually scenario-based, and they all have you demonstrate that you have this skill. So in this example, this is one of the questions from the Accessing Telehealth Appointment Assessment. You can see that the person has to kind of troubleshoot this, what's going on in this scenario. And I'll show you where the assessments are, but I just want to show you, here's another example where someone has to decide, how to schedule an appointment. So they have to click on the place where they'd schedule an appointment. So you can find all these assessments again on our homepage, which is digitalliteracyassessment.org. And here again is the kind of landing page. So if you scroll down a bit and you go to the green oval where it says take an assessment, and you click on that, and then just ignore this part about the 4-digit PIN, just scroll down, you'll see all of the assessments here. And what happens when you take an assessment is, let's say I clicked on Internet Basics. I would first hear some cello music to test my audio because there is audio. And then I would have the option to see a video, and the video, kind of orientation video, which was about 5 minutes long. So you can either see that or not. And then the assessment would start. And so I highly, highly encourage you all to take one of these assessments. If I was talking to you in person, I would stop here and actually give you time to try taking an assessment. For most of you, it will take 5 to 10 minutes, depending on your comfort with digital literacy, as well as kind of what topic you pick. But I guess I will show you kind of what it looks like here in this demo, if we have time. So I'm just going to go to basic computer skills so you can kind of get an idea. Here's the music.
This video will show you how to take our assessment. If you already
get this. So this is where it starts. This is basic computer. This is the very basic one. And then we would start.
Click on the desktop computer.
So you can hear that there is audio that goes along with the fact that the words are printed here. And you can slow down the audio, you can speed it up, you can turn it off. There's closed captioning if you for any longer audio pieces. And so a person will go through this. If they don't know, they click I don't know. That's the best answer instead of guessing. And then they'll get to the end of the assessment and get this results page. And Northstar says you have to have 85% or higher to pass. But what's nice about this is, so it's sometimes people will say, well, I don't want to take an assessment before I've learned anything. And it really isn't how you present it. You want to say that this is really just to see what they already know. And if there are things they don't know, that's great, because it's ensuring that you're going to do your job correctly, right? So that you know what they need to learn and you're going to teach them those things. So if you look in the green column over here on the left, these are the skills or standards that this person has passed. And then in the gray column on the right, these are the skills or standards that, this person has the option to improve on. So again, they know what they need to work on, you know what they need to work on. And then the nice thing is that once they've had some instruction, they can come and take the assessment again and see their score go up. And I have seen that be very powerful for people to see that and help them persist. In fact, I had a woman who she was gifted a laptop. She had never used one, didn't even know how to turn it on. She went to her local library, which happened to have Northstar and have someone who could help her. And she took an initial assessment, and I think she got like a 23%. So then they started focusing on what she needed to learn. And after about 3 weeks, she took the assessment again, and I think it was a 67%. So she hadn't passed, but she tripled her knowledge, and she was so excited. She asked the librarian that was helping her to email me at Northstar, her story, and to share her name and her picture with me. And so that was just, as she said, it was life-changing. So even though she still hadn't passed, she could see that by putting the time and energy in, she had learned something, which is oftentimes people with lower digital literacy are very afraid of computers. They're afraid they're going to break them. They're afraid they will mess it up. They're afraid oftentimes of their own ability to learn the material. And so seeing that they are making progress and changing that score is really, really powerful. I've had people start crying when they pass the assessment. I've had people give me high fives. It's just really heartwarming and cool to be part of that process. So once you've given the assessment and you know what someone may need to learn, we do have, in the free version, we do have some curriculum for you that might be interesting. And, of course, that developing anything from scratch takes a long time. If you have, again, access to the Northstar, if you're a Northstar subscriber, or, a lot of, I should show you this, a lot of libraries across the United States do subscribe to Northstar. So you could direct one of your learners there to get some instruction. But we also have some external resources that we did not create, but that we feel are aligned to the standards that are free. And we do have what we call our practice lessons, so our online, self-directed online learning practice lessons. There are a few of them that are available for free, and they are the same as the ones in the subscription version. The only difference is they're about 90 minutes, and in the free version, you can't kind of stop and start. You just got to kind of sit for the 90 minutes. And I'll show you what each one of those looks like. So the external resources, you will find, well, again, I probably should show you where to find these. So if you go to here, I'm on the Northstar homepage. If you go to Build Your Skills and click on See More, This number 3, these are the other resources. We don't have one aligned with the telehealth yet because that's been kind of newly created. But, for the basic computer skills, internet basics using email, you can find each standard. It will tell you what the standard is. And then this resources that we feel do include a good version of training that standard. Again, these aren't something we created, but it will tell you if it's a text, if it's something like a video, or if it's an activity. So this can be a place for you to start. And then the other thing I want to just point out is also under that build your skills. So the yellow oval on the front landing page. Number 2 here, these are those free self-directed online learning practice lessons. So you can see we do have the basic computer skills and the email available here, as well as Word and Career Search. I want to show you what these look like because it's easier to envision it that way. So I'm going to show you a piece of the practice lessons from the basic computer skills. So let's take a look at that. So I'm going to play the audio. I believe I'm sharing my sound, yes. And won't talk until the woman's done reading this.
If you look closely at the outside of a computer, you will see buttons and many small holes. These holes are usually called ports. Each port has a specific shape for different uses and different types of plugs.
So you can hear that she reads very slowly and clearly. Again, you can speed up the audio, you can slow it down, you can turn it off. There is closed captioning for any embedded videos. And then our philosophy at Northstar is that you can't really learn digital literacy through lecture. You really have to get in there and practice the skills. So I'm going to click on the next button to show you an example of that practice piece.
Here is a flash drive that you can plug into a computer. Click on the port that matches it.
So then if I click here, I'm told, yep, this is a USB port. If I had clicked on the headphone jack, I would be told, no, this is a headphone jack. Look for something that matches the shape of the flash drive. And so the way the Northstar online learning practice lessons are set up is you'll have this kind of instructional piece, practice piece, instructional piece, practice piece, and then there'll be a little quiz. And the quiz will say you're ready to go on in the module or go back and review X, Y, and Z. And then there's probably 3 or 4 of those kind of sections. And at the very end of the module, the little quiz, which is, they're about 3 question quizzes, will say you're ready to take the assessment again, or, practice these things. So it really helps tailor each Northstar online learning to the individual's needs. If you look up here in the menu button, which is on the upper right, with these 3 dots and 3 lines, again, these are the standards. They're kind of aligned to the standards. So you can kind of move around here depending on what your needs, what someone's needs were on the assessment. So that's kind of what Northstar has available for you for free. And I really, again, highly, highly encourage you to take one of the assessments. Well, 1, just to see what it's like and see if it would be useful to the work you're doing. 2, because I have yet to meet anyone who has passed all 15 assessments with 100% on the first try, even those in like IT. So what does that say? It just goes to show that all of us, that digital literacy is lifelong learning. Most of us taught ourselves digital literacy, and so we might have gaps in things that we haven't had to do yet, or maybe we haven't learned the most efficient way of doing it. And so we can all, even if you only use this for yourself, we can all benefit from professional development around digital literacy skills. And if digital literacy is something that you are not used to teaching in healthcare, this can help you feel more comfortable with teaching it when you yourself pass the assessments. So I want to now talk about the Digital Equity Act. Hopefully you know about this, but it's a federal act. There's a lot of money, billions of dollars that are going to states, but also to organizations to cover digital equity. And so that would be that the devices, making sure everyone has affordable Wi-Fi, and then or internet, and then digital skills are included too. There are digital equity. This is kind of a snapshot of Digital Equity Act. It's much, as you can imagine, it's a lot longer. And it talks about the covered entities. There are many, but I want you to see that healthcare is one of them, and digital literacy. Also adult education, libraries, workforce. And then there are every state has submitted a planning process. So all 50 states have said, yes, we are interested in getting these funds. And they submitted this is who's going to be our planning committee. And they're in that process right now. The planning committees have gotten the initial funding to do their planning, which is a year-long process. And the planning includes, bringing together a lot of these covered organizations to look at how can you serve your state and increase digital equity. So what I want to be sure is that, and I'm not seeing it as much as I would like, is that healthcare is at these tables. That patients need these skills, and you want to advocate for them. So finding out, and I'll show you how to, finding out who's on your Digital Equity Act planning committee in your state, and how to reach them, how to get at those tables, who in healthcare might be at those tables. That is a really good thing for you to look into and to kind of promote as much as you can. There are also going to be competitive grants available this summer, I believe, summer or fall, directly to organizations from the federal government around digital equity. And again, healthcare is one of those covered, or one of those program types that can be involved. And partnerships are really highly valued. So if you are partnering, if you can find a library to partner with, or adult education, or some other kind of entity where perhaps you bring certain skills and they bring a population, or they have a place to, have a community, like maybe it's public housing or something where there's a lot of people that are there, that is going to look more attractive to the people giving out the grants. So there's a lot of money. It really, we do want to think of this as, how can an individual in a state kind of have this seamless integration and be covered no matter where they are in the state, no matter who they are, to get digital equity, and to know that everyone has a right to, digital equity, and that they have a right to healthcare as well. So who are partnerships that you could explore? Libraries often, there's a big movement in libraries right now to have telehealth booths. So they're like little mini rooms, and people can check them out, and they would have, a device, they would have internet access, and they may have someone at the library to help them learn skills, digital skills, but it might also be having them just set up a telehealth appointment. So we have seen, there's a small library in Texas, in rural Texas, who's partnered with their healthcare clinic. Clinic sends over people who otherwise couldn't do telehealth. The library sets them all up, teaches them skills, and so then these people have access to telehealth. I know Delaware is doing a lot too. Delaware libraries are doing a lot with telehealth booths and having digital navigators at the library to help. So again, that's something that you can think about, how you bring your expertise to maybe the libraries, and maybe you are there being the digital navigator. Maybe your organization is helping the libraries learn different skills, however it makes sense for you. Adult education is another good partner. They are focused on helping people with lower literacy levels, and so they know how to work with that population. And if you have healthcare expertise, then that's a really great partnership. Public housing, I mentioned, community centers or senior centers might be another good place to look for potential partnerships in your community. There's also a concept of digital navigation or digital health navigation. This is helping people to acquire digital skills, maybe digital navigation varies from place to place, but it might be helping them get access to low-cost devices or free devices, Wi-Fi hotspots, how to sign up for the ACP, the Affordable Connectivity Project program. And maybe providing some digital like tech support. Many institutions, especially with the Digital Equity Act, are going to be having digital navigators. And so if you have someone specific for digital health navigation, that's a bonus. I was just talking to someone here in Minnesota who they have worked with a nonprofit who help teens get jobs in the health teens from underserved populations get jobs in the healthcare field. And they are working with Hennepin Healthcare, which is a county here, they teach those teens the digital health navigation skills, and then they're working helping the populations that they come from with learning those skills. So they're the people in their communities. So they're trusted because they come from the community. They're learning technical skills as well as healthcare skills, and they're being paid. And it's kind of then of course the clinic is having patients learn the skills so that they are better equipped. So it's a great win all around. Having a navigator, especially a one-on-one navigator, as I said, digital literacy can be scary for people. Computers can be scary. So having that person that's really there, listening to someone, encouraging them can make a world of difference. So how do you get involved in the Digital Equity Act or see what's going on? You want to look at what your state is doing. This state-by-state digital skills map, is just that. And so you can click on whatever your state is. I don't know, I'll pick Colorado. And then you can see kind of what the opportunity is. You can see what the state is doing, what your state is doing, maybe who's involved in the planning, and start getting connected with what your state's doing. That's a great place to start. And you'll have access to these slides. The partnerships I mentioned. National Digital Inclusion Alliance is a nonprofit that has been around for a while, and in the past it mostly advocated for broadband access, but recently they've really expanded that to include all parts of digital equity, and they have a great listserv where there's a lot of nationally enthusiastic people about digital navigation, digital literacy, digital equity. So you can put a question to the listserv, you'll get a lot of great answers. You'll see a lot of good topics. So they're a good organization to kind of start following. And I have no affiliation with them, but they have been very helpful. And then even in the news, looking in your local community, who's doing things around digital equity and digital literacy that you could potentially partner with, that you can bring something to them. So here is a list of resources. The first two kind of talk about the Digital Equity Act. Here's another state, the leaders of the Digital Equity Act, state by state. The Digital Literacy Resource Guide, this is great for just in general, how to work with adults around digital literacy. A lot of it is kind of theory, but then there are some practical pieces as well of things you can do. And Northstar did help create this. It's free, but the Barbara Bush Foundation and Digital Promise were really the lead authors. And then we at Literacy Minnesota have some free courses on using Northstar. that you can register for. They're free, they're online. And then of course our website, which is the digitalliteracy.assessment.org. If you have any questions about the subscription of Northstar, you can contact me, or any other questions from this presentation. So thank you so much for listening to the presentation. I wish I could have been with you in person, or at least live. But I hope that you have a wonderful rest of your day or evening, depending on what time it is. And thank you for all the great work you are doing around health literacy. Goodbye, everybody.